Hello, everyone. Very good evening to all of you. I hope all of you are doing great. So we are going to discuss today the integrated pattern of pathology questions. See, related to pathology, I would say that as per the weightage of MCI, number of questions in pathology is only 13. Fine. But if you see the questions, all pathology questions will be integrated with internal medicine. And I can say that when you are going to see the questions in examination room of medicine and pathology, you will not be able to differentiate, okay, this question belongs to medicine or this question belongs to pathology, because entire pathology is, okay, like entire pathology is complete medicine only, right? So I can say that along with patho and medicine, along with patho and internal medicine, okay, number of questions actually 50. So pathology is a big subject which you have to clear, which you have to learn at any cost. Okay, you are not going to leave pathology. Okay, the most important subject out of 19, I would say this is pathology. Okay, on the basis of pathology, you can solve all other subjects. Okay. So far, we have discussed the questions of anatomy, physiology, biochemistry, pharmacology, and microbiology. Okay, 5 non-clinical subjects are completed. I just have given you basic orientation, and now I will be discussing all pathology questions. Okay, no? Fine. I will be discussing 5 to 7 questions only. I think I will take half an hour to 45 minutes so that you can have orientation, and people who are going to prepare for December exam, you should start as soon as possible. So fine, first question for you. A child presents with problem in walking, seizures, and inappropriate laughter. Her IQ is not appropriate as per her age. I can say that she looks like mentally retarded, right? Which abnormality can cause her symptoms? Answer me, please. A, B, C, D. So this is a picture-based question, and this is a question of internal medicine. I can say that this is a question of, okay, this is a question of genetics. All right. So do you have any idea what exactly I'm asking you here? Very easy question for you. Very easy question, I would say. See, if you can see the picture and if you can understand the symptoms, if you remember all these points, then easily you can solve. Okay, so most of you are writing C. So you are thinking that this is Down syndrome? Really? No, Downs are completely different. Okay, Downs are completely different. And even the photo which you are seeing here in Down syndrome, everything will be different. Size of the head, face, opening of the chin. Okay, everything will be different in Downs. Yes, I can say that. I can say that Down syndrome is, okay, Down syndrome is the most common cause of the mental retardation. I can say that. Okay, no? So Down syndrome is the most common cause of mental, mental retardation, followed by Fragile X syndrome. I can say those points. But here in this question, what is happening here? See here, inappropriate laughter. Doesn't she look like a happy puppet? Happy puppet. Have you heard this name? Happy puppet. So you know what? See, when I see this case, I see her as a happy puppet. She looks like a happy puppet. Anytime she can laugh, anytime she is laughing, and she is also okay as a mentally retarded. I can say mental retardation is there, but she is having some problem in walking also. I can say that she is having ataxia. She is having ataxia. She is having seizures. Okay. And apart from that, as mentally retarded and inappropriate laughter. See, all these signs and symptoms are giving me one hint that she is having happy puppet first. Okay, fine. So this looks like a case of genomic imprinting. I hope if you remember genomic imprinting. Genomic imprinting. Genomic imprinting. What is this genomic imprinting? See, usually what is happening, a person will get how many alleles? Up to 2 alleles will be received by a person, one from father and one from mother for a character, right? Okay, now fine. So both alleles are supposed to be there in a person. But you know what? See, like in some condition, one allele will be silenced. Okay, one allele will be silenced. This is called as imprinting. So please understand that whenever there will be, so you know, like this silence of either there can be maternal allele or silence of maternal allele, or there can be silencing of paternal allele. Whenever there will be silencing of one allele, that is going to cause a problem. And this is called as pathology due to genomic imprinting. There are 2 which we have learned before also. Okay, so this is the general pathology, right? Okay, one is called the Predatability Syndrome. Second is called as Angelman syndrome. Okay, now we are going to learn that allele deletion of, we can say that 15 number chromosome. See, both are involving chromosome number 15. So I can say that, whenever there is transcriptional silencing of maternal allele. See, whenever there is transcriptional silencing of maternal allele, this is called as maternal imprinting. Okay, maternal imprinting. Whenever there is transcriptional silencing of paternal allele, I will say this is paternal imprinting. Easy to understand. So please understand that. Okay, see, I'm talking about the chromosome number 15 here. See, whenever there will be deletion of paternal chromosome, whenever there is deletion of paternal chromosome number 15, this gives rise to a syndrome that is called as the Predatability Syndrome. But if there will be deletion of maternal chromosome number 15, maternal, this gives rise to Angelman syndrome. So whenever there is silencing, whenever there is deletion of one allele, then what will happen? There will be uniparental disomy of another. Fine. No. So like either I can say that there is deletion of paternal chromosome number 15, or I can say that there is uniparental disomy of maternal chromosome number 15. In this way, we can describe it. Fine. No? So whenever there is deletion of paternal chromosome number 15, this is called as Predatability Syndrome. And because of that, patient will have what? Mental retardation, obesity, hypogonadism, and hypotonia. But what about Angelman syndrome? I can remember with this one, right? I can remember with this one, angel and mother, right? Maternal chromosome number deletion. Maternal chromosome number 15 deletion. Fine. So Angelman syndrome. What is happening in Angelman syndrome? See, there will be mental retardation, and patient will also have seizures, ataxia, difficulty in walking, and inappropriate behaviors, inappropriate laughters. At any time, patient will be laughing. Fine. So this is what? So Angelman syndrome patient, that will also be, they will also be considered as happy puppet. Fine. So answer is what? Answer is B only. B. Fine. So this is a case of Angelman syndrome. This is a case of Angelman syndrome. So this is, okay, so the topic from where I have made this question, this is, okay, this is the genetics part of your general pathology. And this topic, Angelman syndrome and Prader-Willi syndrome, I'm telling you, repeatedly asked question in MCI, in AIMS exam, in NEET PG exam. Okay, so do not forget this part. Okay, so these are the cases of what? Genomic imprinting. Fine. Sure. Next question. A 25-year-old woman presents to your clinic because of the trouble with her vision. Okay, physical examination reveals a very tall, thin woman with long and thin fingers. Okay, examining her eyes reveals the lens of her eye to be in the anterior chamber. Lab investigations show normal levels of methionine and cystathionine. Which of the following is the most likely cause of this patient's signs and symptoms? So answer me, please. So first of all, you have to diagnose the case. So basically, this is a question of medicine. Yes. And after that, I have asked you the options of pathology only. So if you understand the pathology, you can solve this medicine question. Answer me, please. A, B, C, D here. I think with this clinical scenario, you can understand the case. See, I'm telling you that like she is 25-year-old woman. Okay. She is having some problem in her eyes. Okay. All right. She is very tall and thin woman with long and thin fingers. I hope you have got some idea now. Examining her eyes reveals the lens of her eye to be in the anterior chamber. I can say she is having ectopia lentis. Okay. Ectopia lentis. All right. So up to this point, I can say that you have some basic idea that I'm talking about Marfan syndrome. I'm talking about Marfan syndrome, inappropriately tall, fine, disproportionate, tall and thin person. Okay. And what is happening in the Marfan syndrome? See, the pictures, what is the picture? Unusual long legs, arms, fingers, and toes. Fine. And these parts are actually disproportionate as per the body stature. Okay, fine. So what is happening in Marfan syndrome? See, Marfan syndrome is also a genetic disorder. Fine. So that is going to affect, okay, that is going to affect the connective tissues, right? No, that is going to affect the connective tissues. Okay, the tissue that supports skeleton and internal organs. So mostly in Marfan syndrome, okay, which organs are affected? Okay, so mostly eyes, heart, and blood vessels, and the skeleton. Final. So okay, so these are going to be involved like in Marfan syndrome. Fine. So what is happening here? So why these, okay, why these, why these organs are getting affected and why patient is having this kind of different, okay, like disproportionate stature? Why? See, because this is a genetic disorder and that is going to, and you know what? Okay, so there will be, okay, defect of a gene that is called as fibrillin gene. Okay, fibrillin. Fine. Say fibrillin is, okay, say this is going to enable the body to produce a protein which is going to help to give the connective tissue its elasticity and strength. When this fibrillin is defective, When this gene is defective, after that patient is going to have what? Marfan syndrome. So basically I'm talking about which gene? Okay, the gene which is responsible for Marfan syndrome. C, answer is C only. Okay, which chromosome number? Okay, which chromosome number? Marfan syndrome, same like Angelman syndrome and the Prader-Willi syndrome. Okay, no? And the Prader-Willi syndrome. See, this is also, okay, so this is also because of associated 15 number chromosome. Okay, chalo fine. Okay, next question. A 35-year-old man gets bone injury to his hands. Over a few weeks, the bone skin heals without the need for skin grafting. What is the most critical factor responsible for rapid healing in this case? So basically, I'm talking about a bones case, and after that, there is rapid healing of the skin. Fine, no? Why? So what is the pathological, okay, what is the pathological connection here? Answer me, please. I think this is an easy question. A 35-year-old man gets bone injury to his hands. Over a few weeks, the bone skin heals without the need for skin grafting. Say skin, when we talk about the skin is having what? Say skin is having epidermis and the dermis. Epidermis and the dermis. So the most superficial, okay, so the most superficial part is what? Epidermis. Okay, so which is, okay, which will be replaced from the basal layer constantly. Okay, no, but the dermis part, which is actually thick, okay, which is actually the thick part, and the dermis is containing adnexal structures, skin appendages, right? So adnexal structures, these are containing epithelial cells, which can proliferate and which can heal partial thickness wound by epithelialization. Okay, no? So here in this case, what? Related to the remnant skin appendages. Fine, easy to understand. So because of the remnant skin appendages, okay, there is rapid healing of the skin. Okay, fine. Next question. Okay, see here, after the dissection of gallbladder from a patient of gallstone, okay, gallbladder is sent to histopathology lab. On histological studies, epithelium was found to be tall columnar epithelium. What is the interpretation? See, this is the normal protocol that whenever a surgeon is going to operate, okay, whenever a surgeon is going to operate on any case, like suppose, okay, like suppose if there is a case of the gallbladder stone, okay, suppose if there is a case of the gallbladder stone, okay, there is a case of cholelithiasis, and after that, removal of gallbladder is supposed to be done. Okay, we have to do cholecystectomy. Fine, so we have to remove the gallbladder, because see, whenever a stone is there, okay, like there is always some risk of transformation into malignancy. Fine, so every time gallbladder will be sent to histopathological lab, okay, for the histopathological examination. Easy to understand. Fine, because okay, so after that, pathologists are supposed to check, okay, supposed to study the gallbladder, okay, whether there is any risk of, okay, whether there is any risk of malignancy in future or not. Fine. So even, you know what, suppose okay, suppose if one pathologist is saying that, okay, yes, okay, like he is having some malignant changes, or patient organ is having some malignant changes. So the second question is coming that how many pathologists are supposed to give the consent that yes, okay, no? So like this should be verified by how many pathologists? At least number of pathologists should be at least 2. Okay, so 2 pathologists should confirm that yes, patient organ is having, okay, malignant changes. Okay, fine. So in this case, after the examination, pathologists, they have written on the paper that epithelium was found to be tall columnar epithelium. It looks like normal. I hope you remember the lining of the gallbladder. Okay, the columnar epithelium with brush border. right? So this is a normal gallbladder. This is a normal gallbladder. See, this question was asked, I think, sometimes in IMSS. But this is a beautiful question, very easy question, I'm telling you, very easy question, which has been asked in a clinical fashion. Easy to understand. Answer is C only. Fine. Okay. Now, next question. Histologic sections of lung tissue from 65-year-old woman with congestive heart failure and progressive breathing problems reveal numerous hemosiderin-laden cells within the alveoli. Which of the following is the cell of origin of these heart failure cells? So basically, this is mentioned here that heart failure cells. I hope you can have some idea about this question. Very easy question for you people. So heart failure cells, when I talk, see, even if I can recall my one-liner memories, I can say heart failure cells, this was something like, okay, this was the macrophage cell. Okay, these were actually the macrophages, okay, seen in, you know, seen in lungs, right? Seen in lungs. So what is happening here? So please understand that. See, please understand that whenever you are going to have a case of the congestive heart failure, fine. So what will happen there? See, in the lungs, what will happen? Alveolar macrophages, okay, so these are going to phagocytize, okay, these are going to phagocytose the RBCs. RBCs will be accumulated there, okay, RBCs will be accumulated in the alveoli. In a case of the congestive heart failure, so these are being phagocytosed by whom? By macrophages, by macrophages. Okay, fine. So see, especially in the lung, what kind of macrophages we have? Okay, we have heart failure cells. Okay, heart failure cells. Okay, so these are actually which type of cells? Okay, these are actually macrophage cells. Okay, macrophage. So you know what? See, when I talk about lungs, okay, when I talk about lungs, okay, so macrophage cells are the heart failure cells. So see, in different organs, we are having different macrophages. So if I ask you, what about liver? See, which type of macrophages are seen in liver? Answer me, please. See, we have the Kupffer cells. Fine. See, when I talk about CNS, okay, which type of macrophages we have in central nervous system? We have microglia, right? Microglia. Okay. And if I talk about bones, see, if I talk about bones, so we have osteoblast or osteoclast. Answer me, please. Osteoclast, obviously osteoblast are the bone forming cells. Fine. Osteoclast, okay, bone resorptive cells. Fine, very good. See, when I talk about renal part, when I talk about kidney, so which type of macrophages we have in kidney? I hope you remember this one. Very good, very good. Mesangial cells, right? Mesangial cells. Okay, all right. So now if I ask you about, okay, which type of macrophages are seen in placenta? See, these all are your one-liner question, but why I am revising all these points? Because, you know, sometimes they can ask you this kind of clinical questions, and as per the organ, they can ask you the name of macrophage cells. Okay. So see, in placenta, which type of macrophages we have? 𝗏𝗏 cells, right? 𝗏𝗏 cells. 𝗏𝗏 cells. Fine. And when I talk about spleen में कौन सा होता है? Spleen we have, okay, we have littoral cells, right? Okay, we have littoral cells. Okay, all right. And what about the connective tissues? We have histiocyte, right? histiocyte. So this question, I hope this has given you just basic orientation that what kind of question can be asked on the basis of macrophages. Okay, different clinical scenario can be, okay, different clinical scenario can be put here, and after that, okay, they can ask you a question related to the macrophage. So if you remember the macrophages in different organs, you can answer this kind of question. Okay, next question for you. Hypertrophy is increase in size of a cell in response to a stress. All right. Which of the following does not represent the example of a smooth muscle hypertrophy as an adaptive response to the relevant situation? Very easy question. I would say this is the easiest question for you today. Very easy question. So basically, I'm talking about adaptation in response to a stress, or adaptations in response to injury. And you are learning this part in your like in the first chapter of your general pathology cell injury part. You are learning there atrophy, hypertrophy, hyperplasia, metaplasia, right? Dysplasia. So here, very easy question for you. Which of the following does not represent the example of a smooth muscle hypertrophy? Especially mention a smooth muscle. Very easy to rule out option. See, a small intestine in intestinal obstruction. Okay. A urinary bladder in urine outflow obstruction. Yes, smooth muscle. What about the triceps? What about the triceps? This is a skeletal muscle, right? No, so answer is C only. See, even like what the bodybuilders are doing in gymnasium club, right? Whenever they are making body, what is this? Okay, due to exercise, due to a stress. Okay, so there will be hypertrophy. Hypertrophy means what? Increase in size and function, right? Now, so when I talk about the triceps, okay, this is not a smooth muscle. So answer is C only, right? See, last question for you. A 70-year-old male has difficulty in urination associated with increased urge and frequency. He has to get up several times in night simply to relieve himself. There is no history of any burning, micturition, and lower back pain. Okay, so I can rule out UTI and all. Okay, on rectal examination, he has enlarged prostate. Which of the following represents the most likely change in the bladder of this patient? So basically, overall, this is a case of BPH. Overall, this is a case of BPH, benign, okay, benign prostate hyperplasia. So basically, this is what? Hyperplasia of prostate. So now you can answer me. I hope I am thinking that most of you are going to mark C only, right? C. Chalo, theek hai. I want to check. So what is the answer? This is a case of atrophy, hypertrophy, hyperplasia, or hypertrophy. So when I discuss about atrophy, see, these are, atrophy, hypertrophy, hyperplasia, metaplasia, these are the, these are responses, these are the adaptations of cell in response to a stress, in response to any injury, right? Fine, all right. So when I talk about atrophy, atrophy means what? See, atrophy means what? There is, decrease in cell size and the number, fine. So what is happening here? So this can happen because of the ischemia, because of the aging, right? Because of the malnutrition, all right? So this is not a case of atrophy. Okay, very good. So what about hypertrophy here? What about hypertrophy? See, what about hypertrophy? Hypertrophy means what? Hypertrophy means what? There is increase in size and function. There is increase in size and function of cells. So where you are going to see hypertrophy? See, when, you can see hypertrophy during the puberty. Okay, see, lactating breasts. And yes, skeletal muscle fibers after doing exercises in gym. Okay, so hypertrophy may increase in size and function. What about hyperplasia? See, what about hyperplasia? hyperplasia, as in the case of BPH, okay, benign hypertrophy, okay, benign prostatic hyperplasia. What is happening there? See, what is happening in hyperplasia? See, there is increase in number of cells, increase in number of cells in the tissues. Fine. So what are the examples of hyperplasia? See, okay, the breast development, okay, the breast development. So during puberty, I can say during endometrial hyperplasia, I can say BPH, yes. And what about, like after partial hepatectomy, hyperplasia of liver cells. Fine. So hyperplasia we can understand. What about metaplasia? What about metaplasia? When one mature epithelium is going to be replaced by another mature epithelium. Same, we can give the example of Barrett's esophagus. So that is metaplasia. Fine, easy to understand. But when I talk about this case, most of you are confused. Okay, most of you are confused. This is the case of BPH, and an examiner is asking about the prostate. So you are marking C. No, examiner is asking which of the following represent the most likely change in the bladder of this patient. Bladder because of BPH. See, because of the BPH, what will happen? There will be obstruction. So there will be obstruction in the urine outflow. So what will happen? Smooth muscle in the bladder undergoes hypertrophy. So examiner was asking about the bladder and not about the prostate. Okay? So here answer is B only. Answer is B only. Okay? So actually, see, like when we are going to make clinical questions out of pathology, see, entire medicine is there and we can make so many questions. So I have just asked 7 questions, and I would suggest you people that whenever you are going to learn pathology, at that time, please, you have to correlate with internal medicine. Okay, no? And I would suggest you that whenever you are learning medicine or surgery, whichever topic you are learning, suppose if you are learning, okay, so general part of surgery, maybe you are learning about peritoneum, or you are learning about a small intestine and large intestine. At that time, I would suggest you to please go through the pathology of small intestine and large intestine, right? Whenever you are learning, okay, whenever you are learning medicine, so I would suggest ki surgery or medicine, whatever you are learning at that time, please have a revision of general pathology and systemic pathology. Have a revision so that you will be having good clarity about the concepts. Okay, so pathology is going to give you the concept, and on the basis of good concepts, you can solve your question in a right manner. Okay? Chalo, fine. So that's all for today. Hopefully we can try to do one thing that. Okay, no issues. You have done mistake, no problem at all. Hannah, no problem at all. Okay, Dr. Frunzi is writing, sir, aap daily 10 questions karwa do, clinical case, okay, topic wise. So I can do one thing that, see, every day up to 10 questions, this is difficult, but yes, frequently I can come online and I can give you the orientation of clinical questions. Okay? So we can have a plan, and after that we can update you people. All right. So at least minimum once in a week, minimum every Sunday we can do, okay, 10 to 15 clinical questions. So I think this will be convenient for you people also, 10 to 15 questions on every Sunday, or we can try to come live, okay, frequently. Okay. Chalo, theek hai. I will plan with my team. Okay. I will plan, and after that we can update you people. Okay. So that's all for today. Thank you so much, and I wish you all the best, all of you who are going to prepare for December exam. Start your preparation as soon as possible. As soon as possible, I would say. And whenever you are going to learn, because approximately 150 questions will be, okay, will be clinical questions. So whenever you are going to learn about anatomy, physiology, biochemistry, all non-clinical subjects, you have to think about all clinical aspects. Okay? Chalo, fine. Then see you very soon. Okay, take care. Have a good night. All the best. Stay safe. Bye-bye. Thank you so much. And for the further information, you can click on the description below. Fine. Chalo then. Okay. Bye bye.